A cat in a hat kind of thing, whatever you like, just give them a sentence to write, and then so you can evaluate that and then document that as well. Are you able to count backwards 10 by 2s?
10, 8, 6, 4, 2, 0.
Are you able to count by 3s to 15?
3, 6, 9, 12, 15.
Okay. And so then from a logical and reasoning assessment, we consider that an arithmetic calculation, and I would be okay with that. Bill would be okay with that as well. And can you tell me what today is?
November 30th.
Do you know where you are?
Capital University.
What's on your Christmas list?
New car.
You're supposed to say an A in the class. So then we've assessed his level of consciousness, his behavior is appropriate, he smiles appropriately as well. His mood and appearance is appropriate for condition and time and place as well. The next thing that we will take a look at is I'm going to give you 3 things to remember. I'll ask you at the end of the assessment what they are. The first thing is an orange. The second thing is a bear. And the third thing is a penny.
Okay.
So those are your 3 items to remember at the end of the assessment, and that will assess his memory and mind as well. So sometimes I tell people to kind of write them down just so that you know what those items are too. The next piece is if you will, occlude your right nares. Deep breath in. Occlude your left. Deep breath in. Testing patency, and then if you will, close your eyes. Tell me what that is.
Vinegar.
One more thing. Tell me what that is.
Cocoa or chocolate.
Again?
It smells sweet.
Sweet, that's cool. Vanilla. So it's vanilla. Vanilla and vinegar. You don't cook much, right?
I do. It's real bad.
So we tested cranial nerve number 1. Next we'll test cranial nerve number 2, and I will ask you to hold this at 12 to 20 inches and tell me if the smallest line that you're able to read.
Yeah, the bottom. I can read the bottom.
Could you read that out loud for me?
All across the bottom here.
Backwards,
X 00 937824.
Okay, good deal. And then a question on your test as well, and that Bill and I could ask you a question about. Nate, if you could cover up your right eye. I am going to cover up my left eye, because, and I tell people how you remember this is that it will appear that it's the same eye for you as you're facing the patient. And then, are you able to see my hand?
Mm-hmm.
Okay, good.
No.
Tell me when you see my fingers wiggle.
No.
Good. Tell me when you're able to see my fingers.
No.
Tell me when you're able to see my fingers. Can you see them now?
Yeah, I can see. Yeah.
You still see them?
Yeah.
No.
No. No.
Okay, good.
No. No.
Then cover up the other eye.
He's supposed to be gazing straight forward, not looking down, correct?
Yeah. Is he looking? He's not. No, he's not looking down.
He didn't cheat. No, I'm just adding.
Can you see my hand?
Nope. No.
Can you see my hand?
Nope. No.
You're better than me. Can you see my hand?
No. No. No.
So we saw him at the same time with the exception of this one. He saw it before I did. cranial nerves 3, 4, and 6, you can all test together. That's one of those bulk groups. And again, that's where you would test the 6 cardinal fields of gaze. I didn't pin my either. Gosh. He had a little bit of nystagmus as he looked up to his left, but all 6 fields were intact. Next, we'll take a look at his pupils and assess to see if they are equal and reactive. During your assessment, you may have to decrease the lighting. We're going to try just to kind of shade here.
So are you leaving the light on until you hit the pupil and then you're turning it off?
I mean, like when I'm shining the light in. So are you?
I think it's not working because it keeps flickering on and off.
Okay,
There you
I
go.
got it.
So I just moved the light versus turning it off. This is, I think, not staying engaged.
Good to go.
Which would be okay. But basically, you just want to explain what you're looking for, and they accommodate appropriately. They're equal and reactive to light. And so then as we move through there, and we've already taken a look at his positions. So we've gone through that appropriately. You also want to mention his eyelid position. This may be an opportunity to talk about if you would see anything abnormal. The positioning of his eyelids are appropriate without bulging or exudate. There's no styes as well, or signs or symptoms of infection. It's what you might want to talk about a little bit as well in that area. As we begin to look at his cranial nerves 5, 7, and 9, if you could clench your teeth. Clench. Then note your facial expression as well. And then we would test for any sharp or dull sensation. Dull or sharp?
Dull.
Dull or sharp?
Dull. Sharp.
And then dull or sharp?
Dull. Sharp. 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 Sharp.
Okay.
And what's that testing?
Dull or sharp sensation?
Okay. So
Cranial
cranial
nerve.
nerve 5, 7, and 9
5,
was just
7.
that was all clenched teeth and the dull and